Hello, my name is Kim Harms, and I'm a dentist. I've been pretty much around the block in dentistry for about 40 years. I've practiced in many different practice settings, including over 25 years as a practice owner with my husband Jim in a small town in Minnesota. And I've also been around the block a few times in life. I've had a lot of losses in my life, and that's really caused me to spend some time now trying to help people get through the losses they suffer on their own. We're talking today about calamity, catastrophe, and COVID 19, the emotional management of a devastating pandemic. Most of you out there are trying to get your head around what has happened in just a few weeks. And I hope that by the end of this seminar, feel that you're more prepared to manage this catastrophe and perhaps the next one that strikes. Most dentists hope that emotional emergencies are out of their control and there's nothing they can do about them. But I disagree. I believe that managing emotional emergencies needs to be part of our standard of care. And here's why. First, proper management of emotional emergencies improves our clinic outcomes. Next, it enhances patient and team loyalty. And third, proper management of emotional emergencies improves our productivity and our profitability. And there has never been such a large emotional emergency in my lifetime as a COVID-19 pandemic. A few weeks before the pandemic hit, I was giving a lecture to a group of dentists, part of the Minnesota Dental Association in Minneapolis, and I talked about the calamities and catastrophes that can affect us. I had no idea that just a few weeks away, the biggest one we would ever face would hit. So I'm going to talk a little bit about what we discussed about calamities and catastrophes before coronavirus, because I think that learning from those past experiences will help us manage this one. Right now, nobody has been through this before. So we need to use the information we've learned from other dilemmas we faced to try to face this one. Remember the day when we were worried about natural disasters? Tornadoes would affect the Midwest, hurricanes, the southeast corner of the United States, fire in the West Coast, flood just about everywhere, and earthquakes in all kinds of unusual places, including Idaho. We just had one in Idaho. And for many of these disasters, we not only lose our patient base and our team members because they are displaced, we also many times lose the physical structures that we practiced in. And so as we face this new dilemma, one thing to look to is that at least right now we do have those practice structures in place. But we can learn a lot from those people that have suffered through these other natural disaster emergencies. We used to worry about patient conflict. Remember those days? Team conflict was another worry. Embezzlement. Most dentists in the United States suffer embezzlement at some point in time. It's an important issue. The AIDS epidemic was a very large catastrophe for dentistry in the late 1980s and early 1990s because for the first time people became afraid to go to the dentist because of the blood-borne pathogen AIDS. And during that time, through the leadership of the American Dental Association, we learned how to prepare ourselves, protect ourselves, and to protect our patients from blood-borne pathogens. And new standards were set, and they were difficult to place because dentists were not used to universal precautions at that time. I hate to tell you that I actually practiced in the early 80s without masks, without gloves, only for specific oral surgery procedures. And it's scary to even talk about that. It seems kind of archaic, but we did practice that way. And with the new coronavirus pandemic, we will probably be changing what we do to protect ourselves from respiratory viruses a little bit more than we did with AIDS. We are protecting ourselves to a certain degree, but maybe even more. We'll have to see what what comes out during the next couple of weeks and months and years that we can do to help protect our patients and our team from respiratory diseases. Biofilm was a big thing in the early 2000s. Up until that time, we had no idea that there were bacteria and pathogens lurking in our water lines. And in fact, I remember when the first biofilm discovery was announced. It was a Milwaukee news station, and they called biofilm dentistry's dirty little secret. They did a sweeps week every day. There was an article about dental biofilms in Milwaukee, and that went on to national news. 2020, Barbara Walters on 2020 did a segment on biofilm, and this was when everybody actually watched one of 4 news stations. So most of the country watched this, and during that time, they compared toilet water to the water dentists use in our mouths and said that the toilet water was cleaner. So you can imagine, once again, our patients became fearful of going to the dentist, that their health was in danger. So we changed what we did for the biofilms and clean out our water lines now. Things are different. We changed. We'll probably be changing again. Death is always something we fear. Death in the dental office, death of a team member, death of a loved one. This can absolutely turn our lives upside down and create distress amongst not only the person affected, the person whose loved one died, but the rest of the team as well. Many of our team members will suffer personal loss, and sometimes personal losses suffered by patients can affect us as well. I'm going to mainly talk about what happens in our offices when a team member suffers a personal loss. They could lose the death of a loved one, which we just discussed. Divorce has a significant effect on how people feel when they come to the office. Broken relationship, job loss by either the team member or a member of their family, the loss of security. We are experiencing a loss of security right now. Loss of independence is something that many times we fear when something like this happens. And it can also occur later in life when a team member perhaps is getting a little older and might need to reevaluate the job that they do. These are personal losses that affect our team and affect the way we practice. During the 25 years in my private practice with my husband and I, we suffered a number of team losses. I'm just going to go over the major ones here just to give you an idea of what you might expect over a 25, 30-year period. During that time, we suffered 3 suicide losses. 2 of our sons, including my son, was lost by suicide, and a brother of one of our team members. Those deaths affected us for years, and I'll talk a little bit about how you can overcome a catastrophic loss in your family. Infant death. We had a hygienist, one of the hygienists that lost her son to suicide, also lost a baby born after just a couple of days. She had suffered tremendous losses in that time. We had a team member that suffered from breast cancer. We had to adjust how we did things for a year or 2 so she could go through therapy. One of our team members was working normally on Monday and had died on Wednesday from cardiomyopathy. Sudden death. It threw us all for a loop. A divorce of a team member can certainly affect his or her performance. My brother died of a heart attack, which threw me off completely, but just 3 months later, my husband was diagnosed with liver cancer. At that time, we decided we have a large practice, which I couldn't. We had 4 hygienists. I really couldn't do 4 hygiene checks by myself, so we sold half the practice. That caused a significant change in how we practice when my husband was diagnosed with liver cancer. And when someone is diagnosed with cancer, I think almost universally we go right online to try to figure out the chances. What does it look like? And we go from one side to the next trying to find, the best odds of survival. And I remember when my husband was diagnosed with liver cancer, his chances of survival over 5 years was just 5%. So there was a 95% chance that we would lose him. But fortunately, 6 months later, he was able to get a liver transplant. So he is still around 12 years later. And we were very fortunate with that. Depression is something that I suffer from, and I think a couple of other staff members as well. We'll talk about that a little bit later, but getting treated for depression, which is a disease, to get treated for that is a very important thing to do. My husband did not get treated for depression, and after my son died, He suffered some major heart complications that were not present just 2 years before. I think that the heart surgery that he needed was due to not managing the death of our son. My husband and son, when he was young, were involved in a car accident where two young men within our communities died. And that changed things for my husband. He was devastated by that loss and certainly affected my son. And the community, fortunately, we were in a small town. They rallied around my husband. Fortunately for my husband, the car accident, it was not his fault. It was young boys driving a little too fast on a slippery road. My husband could not have done anything, but still it was a devastating effect for him, and it affected our practice for quite some time. A year after my son died, I discovered that I had a radiculopathy, which took out my drilling fingers. Radiculopathy was caused by some problems in my neck that affected my drilling fingers. And in one day, I was working full time one day, and then I was done. Devastating to me. In the middle 1990s, I took my daughter, both my daughters, and my niece, and our office manager's daughter on a trip to California. And on that trip, my office manager's daughter, on a beautiful beach in Santa Barbara with very little wind, very few waves, she dove into a sandbar and broke her neck. And I had to call my office manager and tell her that her daughter was paralyzed for life. Now, I can't even describe to you how horrible that was, that I brought my daughters home. I didn't bring her daughter home. So she blamed me. Of course she blamed me. I blamed myself. And there was guilt and shame and fear that were present in our office for quite some time. And managing that and overcoming that was a very difficult thing to do. But these are just the losses that I suffered in my office. And if you have talked to people that have practiced a long time, you'll find maybe not the same, maybe not the extent, but you'll find similar losses over time. And we need to manage these things and be prepared for them because they're going to happen to us. And whether they're suffered individually or in a group, the pain, the grief, the guilt, and the shame from a catastrophic loss like that in a dental office must be managed. They affect all of us, and our patients come into our dental offices expecting us to be focused and take care of them. And when we're distracted by something like this, we can't take care of them in the way they want to, and they can tell. Patients can tell if we're focused. Patients can tell if we're there for them. They're very intuitive. The problem is, I think, for most of these things is that dentists are in denial. They just hope emotional issues are just going to go away by themselves, that no intervention is needed, no preparedness is needed. But they're wrong. You do need to prepare. You do need to focus. You do need to take steps to keep your dental offices emotionally healthy. So the goal of this course is to help dental professionals understand how to manage the difficult dilemmas they face in life both personally and professionally. And of course, our current catastrophic challenge is a COVID-19 pandemic. I mentioned before that I lost my son to suicide. My husband and I lost our son to suicide. And I will tell you that I also lost my mother to suicide when I was 17. And these were life-shattering events. This was a catastrophic loss. And what I mean by that is it basically changes your world into the way that you see things, into a before and after the loss reality. And Eric was a wonderful, kind, caring, compassionate, brilliant young man. He was a freshman at Columbia University. He loved Columbia University. He was elected to student government his first semester. He played in the jazz program, in the jazz band. He was a brilliant jazz pianist. He did theater, and he was also on the Dean's List in engineering. Brilliant young man, kind young man, caring young man. But 2 weeks into his second semester, his girlfriend that he loved, broke up with him, which is a normal part of life. If she didn't love him, she should have broken up with him. But Eric wasn't ready for that. He couldn't manage it. And he was extremely impulsive, with a brain not fully developed and critical thinking. He was only 19. And he took his life 45 minutes after the breakup. He was that impulsiveness that made him such a great jazz pianist ultimately took his life. And we lost our precious, beautiful son. And so many of the lessons that I learned in recovering from that loss, I'm going to apply to what we're trying to learn today in managing the COVID-19 pandemic. So a catastrophic loss can divide your reality into that before and after mode, where you measure everything before and everything after, because it completely changes things. And the question that I'm asking all of you is, are you ready? Are you ready to manage this? Are you ready for the next issue that pops up? And my hope is that when we're done, you'll feel at least a little bit more ready than you do when we started. So the COVID-19 pandemic does constitute a catastrophic loss for everyone, for the world. It especially affects us because it not only affects us personally, but professionally. Dental professionals, small business owners, certainly the travel industry, will take a long time to recover from this. But our biggest enemy is fear. Our biggest enemy is fear. And we're probably, because this is so new, there are many, many fears that you're probably feeling right now. And I just wanted to remind you that I grew up as a baby boomer. We grew up during the nuclear age, and we were taught as school children to duck and cover, to jump under our desks and hide and cover if a nuclear bomb were to go off. Now, I lived 10 miles from Washington, D.C. My dad worked at the Pentagon, 10 miles. I knew, even as a young child, that duck and cover 10 miles from Washington, D.C. probably wasn't going to work or work very well. I think it would work for people further away, but probably not for us. But it was a gigantic fear. And in fact, when my husband and I graduated from dental school in 1981, we graduated together. We walked down, the platform. And one of the things my husband said shortly afterward is, we've worked so hard for this. My biggest fear is that we're going to have a nuclear attack, within the next couple months, and all this work was for nothing. So even then, we were fearful of a nuclear attack, very much so. But fortunately, it never came. So how much energy do we devote to that fear that never happened? Now, certainly we need to prepare for it, but we need to get rid of our fear. And I hope, again, by the end of this seminar, you have less fear than you do at the beginning. One of my favorite quotations of dentistry, which also describes that we are working in an environment of fear and anxiety. Just before COVID, before anything, patients are afraid to go to the dentist. Some 70 to 80% of patients are afraid or have some anxiety about going to the dentist. So I love Ogden Nash's quote, "Some tortures are physical and some are mental, but the one that is both is dental." And I bring this up because I want to tell you that we have a base level of anxiety that's present in our offices just because people are afraid to come to see us. So we have to go overboard to calm and make our patients feel secure. And before we can do that, we have to feel secure ourselves. So it's so critically important that we feel secure and confident as we begin to bring our patients back into our offices. And we express that opinion now, even before they're back. We communicate that to them through emails, text messages, and our websites. Any way you communicate with your patients, it's important for you to communicate confidence and that you are there to help them. So this is a big loss for all of us. We have lost our dreams right now because they're going to be different. You're going to have new dreams, but they're going to be different than probably what you planned before. Our expectations, your production expectations for the year, for this year, probably not going to be the same, but they certainly can rebound next year. Safety, the safety of our team members, the safety of our patients. We've lost that sense of security there. We have to kind of rebuild that, figure out what we need to do. Health, the health of the planet really right now from a virus that can be very deadly. And certainly of our lives. People are dying from this virus. So there's a lot of losses that we're suffering because of the COVID-19 pandemic. And in dentistry, we can't express our losses as easily as we can. We can't express our grief to people as easily as we can with other professions because once again, our patients are coming in with the expectation that we are going to be confident and happy with a smile on our face to take care of their needs. And we work in a tiny environment of very small teeth that are inside a mouth with moving parts, and we've got to focus a drill in millimeters and partial millimeters to do our jobs. And patients expect that of us, and they expect us to be, again, happy and confident no matter what the environment we're finding ourselves in. The good news is that there are tasks to complete when it comes to mourning. And failure to recover from loss affects everyone around you. And I want to just tell a short story that reiterated that to me. About a month or so after my husband and I lost our son, we had begun to work again, and I will tell you that we were not smiling, and that did cause some suffering among our patients as well. It took us a while to recover. And about a month or so, I think after that, I was leaving the office, and my husband was talking to his cousin. And his cousin has lost his brother at age 19, the same age our son was, when he had gone out drinking one night, and he had passed out, and his friends drove him home in his car and left him in the back seat. Now, in most areas, this probably would not have been a problem, but it was winter in Minnesota, and it was about 20 degrees below zero, and he froze to death. And it was a tragic loss. And my nephew, who had lost his brother, looked at us with the saddest eyes I've ever seen and said to us, "Don't you ever let your loss make your additional children feel, your remaining children feel, that they were not enough." Oh my goodness, that hit me like a dagger. And not everyone could have said that to me at that time because I was still in the zombie phase. I was still in shock. But that hit me. And really what he was saying is, if you allow the grief to consume you and you don't fight, because it's a fight, it doesn't go away by itself. You don't fight to recover. Every person around you, especially the ones that you love, are going to be negatively affected. And you have to work to overcome the grief so that you can be there for the rest of your family, the rest of your team, the rest of your patients. The first task is just to accept the reality of the loss. Now, some people think that's easy. It's not that easy. When you have a catastrophic loss, sometimes it takes a while to realize this really is happening. You feel like you're in a dream, and you wake up and you realize the reality is a nightmare, right? So it's hard, but you have to accept it. You have to work hard to accept it. It's the first thing you do. Till you accept it, you can't proceed through the other tasks. The second task is processing the pain. This is the hard one, and it takes a long time. It takes effort, and you have to focus on, we're going to talk a little bit later about what's going on in your brain. You need to focus on keeping your brain in a healthy place. It takes a lot of work, but you have to process the pain. I wish we could say that somehow you could snap your fingers and the pain was gone. It doesn't go away. You have to process it, and everyone's different in how long it takes to process that pain. The third task is to adjust to the new world. And after the COVID-19 pandemic, you're going to have to adjust to a world that's different than it was before. And hopefully the differences will be, you might have a few new precautions to take, safety precautions in your office. There are probably a number of other changes we're going to make to protect us from respiratory illnesses, maybe differences in office design, who knows. I think we need to take a look at what the American Dental Association is going to be recommending, because I know they're studying it very, very carefully. But it's going to be a new world, and we just have to adapt and adjust and accept it and do it. Don't cling to the past. Don't feel like you've done it this way all these years. Things are different now, and you have to adjust, and that's the third step. And the fourth step is to build a new life and keep the old one kind of safe in your memory, but don't look back. It's there, but don't look back. Don't long for it. Just keep it in a safe place. It's been 11 years since my son passed away. One of the things we mourn when you lose a family member is you have a certain number in your family. We were a family of 5. I had 3 children. And when Eric died, we were a family of 4, and that haunted me every day. It's a strange thing about the numbers when you lose somebody. Right now, we are a family of 12. I have 6 beautiful grandchildren, 2 wonderful new son-in-laws, and we are a family of 12. And I have a wonderful life. I have a wonderful life with I actually work with my daughters, actually with both of them, and I have a wonderful time with my grandchildren. And grandchildren are probably one of the best parts of life ever, I have to say. And I'm really enjoying it. So I have a new life and I have a happy life. Now, I didn't forget about Eric, and one of the things that I did to kind of help uh, keep his memory alive, because that's what you want. You want his memory to be alive. You want it to make sure that his life is not forgotten, that he made a difference. And one of the ways that I did this is I work in Rwanda. Eric loved reading, he loved books. And so I work with Books for Africa, and we brought 34 Eric Carnes Memorial Libraries to Rwanda. And Rwanda, if you want to find people that know how to manage calamity and catastrophe, it's Rwanda. They were a country that was devastated just 25 years ago with a horrific genocide. I can't even go into the details. That's a whole seminar by itself. Yet through forgiveness, which is unheard of really in this world for something like this, and through reconciliation and working the perpetrators back into the communities through Gacacha courts, where the whole community sits down and talks with him or her about what they need to do to get back into the community. They have rebuilt a country that's one of the safest countries in the world. It's as safe as Canada, and one of the fastest growing economies in Africa, and one of the most beautiful people I've ever met in my life. And so we have 34 libraries there. I was actually there in Rwanda working with the libraries when the airport started closing down because of COVID-19. So I had to work really hard to try to come home. It was a difficult thing to get home. But Rwanda is what helped me, and I was helped by these amazing people who had been through their own tragedy, and yet were able to heal. And I kind of felt like, well, if they can heal from what they've been through, I certainly can work through towards healing for what I went through. So anybody needs an extra lesson in healing, I would suggest going to Rwanda. It's an amazing, beautiful place. But that's what I did. I did that to keep the memory of my son alive. Now with the COVID pandemic, that might not be quite as important to keep alive the past, but also the dreams that you had in the past, you can still have those dreams again. It just might take a little pause. You might just have to restart. Maybe you have to work a few more months or years or for retirement. They're going to still be there for you. You just have to rebuild them. The pandemic that you're experiencing right now is going to leave some scars, but please know you're still standing. This is a 2,000-year-old olive tree that's still bearing fruit. Now look at it; it's all gnarled and with it, it's got signs of age, but it's been there for 2,000 years. It's been through a lot, but it's still bearing fruit, so it's still standing. And I think that we need to remember that the goal for recovery is to be able to find joy in your life and live in the moment, despite any permanent scars you might have of the losses of the dreams and the expectations you had in the past. That's a scar. Be proud of your scar and move on and learn from this moment of insecurity. We might be stronger, and I think they probably will be stronger in the future because we're learning how to survive this horrible pandemic. And use your knowledge to help the next group of sufferers, because I think we need to remember that there's other things are going to happen in the future. There might be another pandemic, but use the knowledge that you've learned in this one to prepare for the future and help the next group of sufferers. When it comes to pain and anxiety, it frequently comes in waves. You might feel good for a little bit and then bam, it's going to hit you again. And many times you're going to have some post-traumatic stress from what's happened to your office. Again, worrying about the good old days and being concerned about what's next. I had, after Eric died, my PTSD trigger was the word Columbia, from Columbia University. Now, I have to tell you, my son loved Columbia. There's actually a memorial there for him. But that was a trigger for me. That would send me, when I would hear the word Columbia, my brain would say, your son is dead. That's how it was translated. Also the word New York. When I heard the word New York, I would hear, your son is dead. That's how, it's crazy, but that's how it worked. So for a couple of years, I remember that I would hear those words time and time. And you can't get away from New York. It occurs every single night on the news. You hear the word New York. New York is everywhere. You always hear about New York. But the surprise for me was Columbia. There are so many Columbias out there. I was shocked. There's certainly Columbia University, but there's also Columbia, the country. And during the time that Eric died, they were in the news quite a bit. There was a big drug issue going on there that we would hear Columbia every day on the news. And so every time I would hear Columbia, my brain would translate that into your son is dead. It's crazy, crazy, crazy thing would send me for a loop. There's also Columbia Glacier, the Columbia Space Shuttle. There are Columbia Sportswear, which meant that when I would go through my closet and I would see something that said Columbia Sportswear, or I would go through the mall and I would see Columbia Sportswear, that would translate to me as your son is dead. So those triggers would hit me time and time and time and time again. There, Columbia, South Carolina, and there's 38 different cities in the United States named Columbia. So it was everywhere, and I just could not escape it. And during that time, I fought with my brain time and time and time again. I even called in a higher power. I had my prayer groups working on it. I was working hard to get rid of the Columbia triggers. And I had to go to dedicate my son's memorial to Columbia and to New York, and I was terrified to go. And I just did everything I could. Again, higher power, prayer groups, every single ounce of my energy. And when I stepped off that plane, that trigger was gone. So I was able to get rid of this horrible trigger that affected me time and time and time again. You also have patients that have PTSD triggers. I want to make sure I talk about that right now too, because as baby boomers especially, dental care was not as patient focused back in the day as it was now. And we were taught actually hand over mouth technique where we were to cover the mouth of small children and tell them that we weren't going to take our hand off their mouth until they settled down. I mean, that was taught. That was a technique in dental school. We'd probably be arrested for that now, but in those days, that was an acceptable technique. So there's a lot, especially baby boomers, that when that drill starts up, when that drill starts up, you're just starting up your drill or you're just starting to do some work in their mouths. That drill sends them right back to the dental chair when they were 5 years old and they were suffering from pain or anxiety or whatever it was. So PTSD triggers are very, very prevalent when it comes to your patients. And the trigger is many times the things that we do. So what are the possible COVID-19 PTSD triggers, right? What are the possible triggers for COVID-19? Well, it could be the previously set daily goals. You might come into your office and take a look at the goals that you were meeting, the financial goals, and find that they're short. They might not be there yet. And when you look at the previously set goals, that might set off a trigger and bring you back right into that grief spiral. A schedule that's not quite full. If you were used to having a full schedule and you come into the office and find out there's some openings, that might trigger a PTSD response, and your brain might just go right back to that fear, anxiety, and worry that you might have. Personal plans that need to be canceled. If you were planning a trip to Disney World, I will guarantee you pretty much that every time they talk about Disney World and you can't go, you're going to remember that in your previous life, before COVID, you were going to go to Disney World. And any sign of a respiratory illness. I mean, coughing will have a far greater effect on all of us than it ever did before. We're going to be far more aware of any signs of respiratory illness, and that's probably good. We're probably going to stay home a lot more than we did before. But we have to be aware of these and watch out for these and try to work like I did with my Columbia, New York trigger. Work as hard as you can to get rid of these triggers and work through your brain. We're going to talk a little bit more about that in the neurobiology of trauma. Because where is all of this happening? It's happening in your brain. And your brain is an organ that functions in many times a predictable way. So let's learn about the neurobiology of trauma and what's really going on in your brain that's causing all of these issues. The first thing to do is to meet your amygdala. Your amygdala are it's actually two of them, two little almond-sized parts of your brain that trigger the fight or flight mechanism in your brain. Now, the fight or flight mechanism in your brain was very helpful back in the day when we were going to be eaten by wild animals. We faced that risk, so we had to either fight or flee. But nowadays, we don't really have as many, at least in the United States, personal, physical traumas that we have to watch out for, where we don't have animals that are going to eat us here. We might have a rattlesnake or something if you're out in the West, but and then it would be very helpful. But many times, our amygdala will set off that anxiety, that fear response, and we might not respond appropriately because we're living in a new age. So many times also your amygdala can be aware of the danger before you are, which is a wonderful thing. Again, if you're walking down a path and there's a rattlesnake, you might jump before you even know there's something there. And the amygdala manages fear and emotions and survival instincts, and it has a lot to do with memory. So when we're talking about PTSD, when your patient is lying in the chair and when you start the drill and you see the fear in their eyes and they're having a moment, many times it's your amygdala that is remembering that event that occurred a long time ago. So your amygdala is throwing you down into that pit of fear, throwing you down, and fortunately, we have another part of your brain that helps to bring you back up. Sometimes your amygdala can also overreact. And when you have a crisis that occurs and you let that fear and anxiety run wild and you don't allow the rest of your brain to calm yourself down, you can overreact in some situations. And I think when people are already full of anxiety, as they are during a pandemic, they may tend to overreact a little more than they do normally. So be aware of that. Be aware of patients being more fearful. Be aware of your team members being more fearful. The prefrontal cortex is the part of our brain involved with executive function and critical thinking. And it's a part of our brain that calms down our amygdala. So as our amygdala is throwing us down into that pit of fear, it's a prefrontal cortex that pulls us back out. And it's important to know this because if you're understanding what's going on in your brain, you can be better prepared to fight it by using your prefrontal cortex to say, okay, now knock it off, amygdala, calm down. Probably you don't say that out loud, say that to yourself, but you can actually use a prefrontal cortex to help calm your amygdala even more than it would do naturally. So the prefrontal cortex is involved in the complex decision making as to how do we solve this problem. Your amygdala is going crazy with all the fears about COVID-19. It's your prefrontal cortex, I hope, that's telling you, okay, we're going to be okay. We're going to do this. We're going to do that. We're going to grow our practice during this period when we can't see as many patients. We're going to have a plan to rebound. That's your prefrontal cortex. And it's very, very important to calm your amygdala. It's important also to know that the prefrontal cortex is not fully developed until about the age of 25 in males, a little bit earlier in females. So if you have younger members of your team, they might not have the capacity to really calm themselves down as easily as someone who might be a little older and has had that prefrontal cortex working for a longer period of time. With my son Eric, he was only 19, so he was 6 years short of full development in this area, and I believe that if he'd been older, he would have been able to manage the loss of his girlfriend. So, what do? We need to pay attention to our brain and figure out what's going on when we are suffering the fear and anxiety of the COVID virus. We need to take those negative thoughts and replace them with positive ones. And this has to be done intentionally because right now the negative thoughts have the edge in a time of crisis. So use your prefrontal cortex when your amygdala is going crazy about all the fears you're going to have that the world is falling apart. You take your prefrontal cortex to bring you back and think about positive things. Focus on your family. Focus on the good things that are happening because you're having more time. Also, focus on what's right in front of you. And you may find that you can spend more time with your family. Read a good book or perhaps a couple of good books, and also keep your reading choices positive. Read and focus your mind on positive things. Try to limit the amount of news time that you're watching. Also, you need to get your practice ready for a full start when things improve. The best thing you can do is keep your team and your patients updated with all the things you're doing to keep them safe, all the new things you're going to implement in your office, and the current ones that you have right now. Update them on everything that's going on. Make them understand that you are ready for them when they come back, and that your office is a safe one. Very, very important. So while you're getting ready, you need to communicate, maybe clean, get things taken care of that weren't taken care of before, update your team on all the things that you need to do. This might be a good time for OSHA or HIPAA. Update whatever you need to update. Get that your office manual updated. Prepare yourself for the financial audits that are going to take place. Get ready for anything you can do to keep your team and your practice updated. Protect. Make sure you're adding any protective techniques that are going to be there for your patients when they come back, and reorganize. These are things you can do to get your practice ready for a full start. Also, you can share your concerns. Now, if you're an extrovert, sharing your concerns with friends, with other dentists, not only helps you, it helps them. Let them know they're not alone in this. Some of us are introverts, many dentists are introverts, and maybe you can share them in a journal. But sharing them and not keeping them pent up can help. You can write a journal. This might be an interesting time to write about because our children and grandchildren can understand what it's like to live through this historic time. Exercise and eat well. Don't forget to do that. That's extremely important to keep those endorphins going and to keep you healthy and to prevent you from getting sick. And let go of what you can't control. This is the hardest thing for us. We tend to be control freaks. It's hard for us to let go of what we can't control. But you really can't control what's going on nationally with the COVID epidemic. And you need to let go of that and just take control of what you can control. And those are the things you can do within your offices. We deal as dentists with many patients who are anxious. And an anxiety disorder is an excessive irrational fear and dread. And it's important to know that not only do we suffer as dentists almost twice as much as the general population with anxiety, which is hard to believe, but true. We suffer from anxiety. We tend to be perfectionists. We're suffering personally, but we have to manage, again, that patient suffering, the patients that are anxious to come to our office. And people are anxious over the effects of the coronavirus pandemic. Everybody's anxious about that, so you have to understand that. And the post-traumatic stress disorder can be triggered by sounds, smells, or experiences in the dental office. And new worries now, the old ones that we talked about before, but now there's new worries about spread of a respiratory illness. How are we going to manage that? People need to know. Dentists also suffer from depression at almost twice the rate of the rest of the population. And we need to talk about this because there's still a stigma when it comes to depression among dentists. I suffer from depression myself, and I didn't talk about it when I was still practicing because there was a stigma. I didn't want anyone to know. But I was taking antidepressants. I was also taking antihypertensives as well. And the only side effect I had from the antidepressant was that I was happier. I was in a better mood. The antihypertensive caused me to have a terrible cough, which was bad enough in those days, but like right now, a cough is not something you can have when you're a dentist anymore. People are watching out for those coughs. So it would be even more of a problem now. But be treated for depression. It's really important that if you have depression that you're treated just like you were treated for any other illness. Depression is also linked to heart disease and stroke. My husband, a year and a half after my son died, went through a devastating heart surgery. He had quadruple bypass, he had a valve replaced, he had some other heart surgery done, and his heart had checked out as healthy before his transplant. So basically, in 2 years, his heart was just destroyed. And I think it was related to untreated depression because he did not get treated for depression, but I did. Also, dentists are frequently in denial or they're ashamed of a depression diagnosis. There's no more need to be ashamed of a depression diagnosis than there is to be ashamed of a diagnosis for any other physical ailment. And we need to change how we think about that. So there are many physical symptoms of grief and stress. The two most that affected us are heart disease for my husband and chronic pain. I had a lot of issues with chronic pain and of course the radiculopathy that ended my career could have been exacerbated at least by the stress that I was going through. So you really have to take care of depression. You really have to take care of grief. Again, these are not going to go away by themselves, and they may end up with a very severe, debilitating physical ailment as well. Managing the emotions and building effective intergenerational teams that I hope you're doing in your office right now anyway is even more important in the post-COVID-19 era, because they're all going to need to be working together. They're all going to be a little more careful about the transmission of disease, and they need to know, everybody needs to know that they can all be trusted to do what's right in the dental office. So managing the emotions and building your teams is a critical thing to learn how to do now. So let's get ready for the next calamity, because it will happen. We're going to have more. This is not the last thing that's going to happen to you. It's going to happen. We can't prevent calamities, but we can prepare, we can cope, we can manage, and we can heal. And I have a little mini book, a little mini handbook for emotional emergencies that we'll talk a little bit at the end, but I can email it to anybody that wants it. You can just go on my website and request a PDF copy of this, and I can email it to you. But this is what I like to use to manage emotional emergencies and to help people manage emotional emergencies in the dental office. The first thing you need to do is build trust. Trust is absolutely critically important, especially as we go back to our offices after COVID-19, because you're going to go back to your offices and you're going to feel some financial stress. We all are. Everybody's going to feel that. But you have to always completely put the patient first, and you have to decide that you're going to focus on their needs. The other needs will come. You certainly can do everything you can to schedule appropriately for maximum productivity, so you can still have productivity goals and things like that, but just use them through scheduling. You need to make sure you put that patient's needs first, and they are going to come back to you, perhaps in a financial situation that's not what it was when they started, and you need to really talk to them and build trust with them. I found out firsthand back in the 1970s what can happen if you place your trust in someone that doesn't deserve it. I was born with only 7 fingers. I'm missing 3 fingers from birth, probably due to the fact that my mother took thalidomide when she was pregnant with me. And when I went to college, I was a zoology major, and I met this really cute guy named Jim Harms. Now, this was the 70s, so please don't judge me, but he was really cute. And Jim wanted to be a dentist. Now, back in the early 70s, there were not any female, I'd never heard of a female dentist. It took us a while to get women involved in dentistry, and they just were very few at the time. So I never thought about dentistry before. But Jim was really cute, and so this was the 70s, so I thought, if I had a good job, like maybe being a dentist, Jim would take notice and maybe marry me, right? That was a really good thought, right? Please don't have these thoughts now. I was 17 years old at the time, so please, I was very, very young. But I had these thoughts about, this plan to get Jim to marry me, and so I went to my advisor after the first semester, and I sat down with my advisor, and I should have been a little bit warned. His nickname was Dr. Nasty, so I should have maybe thought to just be careful. But I sat down with him. I said, hey, I'd like to go to dental school. My grades were great. There was no problem there, but I'm missing some fingers. And what do you think? Do you think they would take me in dental school? And the doctor sat back in his chair and smoked his big cigar, because you could smoke cigars back in those days. And he looked down his nose at me and he said, oh no, are you kidding? There's no way they would take you if you're missing fingers. How could you think about going to dental school? You need all your fingers to go to dental school. And at that moment I thought, okay, well, that makes sense. Maybe he's right. And, I'd given up dentistry really for the moment, and I'd have to find another way, of course, to get Jim to marry me, because that plan was not going to work. So I got up from the chair and I was getting ready to walk out the door. And just as I was walking out the door, Dr. Nasty looked up at me and said something that I'm just so glad he said. Changed my life. He said, but maybe if you were a man, they would take you. And do you believe this? How could he say that to me? He didn't care at all about me. All he cared about was his own ego. And I was so angry that I decided I wasn't going to change careers right now. I'm going to change advisors. So I went down. In those days, we didn't have computers, so we went down to the advising office, and there were a whole long group of older women that were sitting there. They're probably younger than I am now, but they seemed kind of old to me. And I went in there and they were not happy with me that I had come in to ask for a change of advisors. How dare this young little 18-year-old freshman girl ask for a change of advisors? So I did. I stuck with it and they gave me one. But when I saw her name, I was terrified because this was Dr. Potter. Now, Dr. Potter had was scary. She was absolutely just scary. She was a geneticist. I took her class, and she was the one in front of this large auditorium at the University of Maryland. She looked down at this big audience and said, "Look to your left, look to the right." And one of those people is not going to be here in 2 weeks. And sure enough, she was right. She was absolutely terrifying. She looked kind of like Marge Simpson's, if you ever see The Simpsons. Sister, she had hair like Einstein, that just kind of gray hair that was just tousled. And she had these tiny little glasses, half reading glasses that kind of hung down low on her nose that she looked through at us. She had a very gravelly voice, and she had a cigarette that was attached to her lips. She smoked and lectured at the same time. And we swear that there must have been like Velcro or something attached to her lip to make those cigarettes. I don't know how she could keep that cigarette balance there and still lecture on genetics, but she could. But she was absolutely terrifying. And so I got her name and I thought, well, okay, I'm going to just do this because I was so angry at the last guy. So I went up to her office and I knocked on the door and she answered in a very kind voice. I was shocked. She asked me very nicely to sit down. She asked what I was there for, and I said, I've only got 7 fingers, and I want to go to dental school. What do you think? Do you think they'll take me? And she sat back and said something else that changed my life. She said, I don't know. I don't know. Let's find out. And she right then and there made an appointment for me to go to the University of Maryland Dental School to talk to the director of restorative dentistry to see if I could do dentistry. So I went down there and the director of restorative dentistry said, can you hold a mirror in your right hand? And I said, yes, I can hold a mirror, no problem at all. And he goes, okay, you can go to dental school. Because when you go to dental school, only one hand goes to dental school. The other hand holds a mirror. Who knew? So Dr. Potter followed up with me. I ended up getting in early, a year early, and in the same class with Jim, who, by the way, the good news is I got him to marry me. This is my plan worked. Ultimately, my plan worked. Jim married me before we even started dental school, and we've been married for 43 years. It all worked out great because Dr. Potter put me first. So I think you need to ask yourself as you're seeing these patients as they're coming in, no matter how fearful you are of the finances of your office, that they know that you're putting them first. That you know how to say, I don't know to something. That you're not going to just tell them what you think they need to hear because of your ego. You need to put your ego aside. You need to put financial concerns aside for you, and you need to focus on those patients. The wonderful news is that all those financial concerns get taken care of when you have a trusted base of patients. So first, build trust. That's the most important thing you can do, and you can do it with some of the information you're sending them, and you can do it through your character and the character of your team members. Secondly, they need to know how we are protecting them. So send the emails, a text, Facebook, websites, handouts, send them all the information they know about how we're going to protect them when they come into our office. Also, but you can become your patient's best source of disease protection strategies. This is a generic poster that you can just get on iStock, and you can fill in the blanks there. You can fill in all the details and communicate that with your team members or any other help you find to do that. But try to make them your own. Try not to just send them something else you saw. Try to make as much as you can your own. Or if you're using someone else's material, certainly make sure you do it correctly and then give them credit. But just say, we found this interesting article and here we're going to send it to you. But make the information your own and make sure they know that you care about their health, not only their dental health, but their overall health. Also, most importantly, be grateful for your patients and your team and let them know how grateful you are on a regular basis. Tell them time and time and time again how grateful you are. It's one of the most important things you can do. I also recommend building an emotional emergency kit for patients and for teams to kind of be prepared when you have a patient having a bad day, who suffered a loss, who has some issues, and they're going to you're going to find there are more of them because there are people that we're going to lose family members through this pandemic. There are people that have lost jobs. They're going to suffer more than you've thought before. So be prepared when they come back. You can hand out some chocolate. That always works for me. Candles, hand lotion, have them kind of available under the front desk, gift certificates. And the easiest thing is just pre-signed cards. Get some cards for different, different situations. You can have some sympathy cards. You can have some blank cards, and keep them under the desk and have everyone sign them. Have them all pre-signed. And then someone comes in and then you find out that they've lost their mother through to the coronavirus. The person at the front desk that greets them can then just fill in the blanks, and you can have some small little sayings or some small little quotations you can put in there. They can fill it in and have it ready when the patient comes out. Imagine if you suffered something like that and you walk out to check out of the office and they hand you a card signed by everybody in the office. It's one of the best things you can do because you're telling them you care about them as a person, and that's going to generate loyalty from your patients. Learn the language of loss. When patients or team are suffering, know what to say. Say, I'm sorry for your loss if they've lost someone, and then stop. Don't try to fix it. That's where people get into trouble. Just express to them your sorrow and stop. Don't try to fix. You can show empathy through your words, body language, and again, these cards are great. The entire staff can sign them. After a loss, one of the best things you can do to someone that's lost a loved one, if you know that loved one in person, is to tell a positive story about that loved one. People kind of think you don't want to talk about the one you lost, but you do. You want their lives to make a difference. I remember when Eric died, the wonderful stories people told me about him that I didn't even know about. They were the best gift they could give. So tell them stories. Tell them a positive story about the loved ones. No platitudes or comparisons. If someone's getting a divorce, don't bash the other party because they could get together again. So just be really, really careful. Be sensitive to religious values too. Make sure you're very sensitive. We live in a very diverse culture, so be sensitive to the religious values when you're expressing your concern for them. Also, give team members a pathway to healing in a tough environment. You need to constantly smile in dentistry. Everybody has to. That's hard to do when you don't feel like smiling, when you feel like crying on the inside. How can you smile? But you have to do it. And we have to give our team the ability to put on that good front. And sometimes we have to kind of go outside of our comfort zone. Make sure that the entire team knows just how hard it is to put on that smiling face. So we really appreciate that you're doing it. We know it's hard when you really want to cry, and recognize and support the staff who are struggling. You need to recognize them. You need to support them. You need to make sure they know you care about them and the work that they're doing. Also, it's important when someone has suffered a catastrophic loss to provide a safe place to go when a grief wave strikes. When you lose someone in your family, for instance, when we lost Eric for 6 months, every time patients came in here, everybody knew Eric in town. So when patients came in and they saw us for the very first time, because the funeral was very busy, we weren't able to see everybody, they saw us for the first time, we had to go through the I'm so sorry for your loss and the remembrances, and it's a hard thing to do. And sometimes you're going to find a team member might just need a moment. They might have been struck with a trigger, and we need to have a way within the staff, within the team, to bring them some help. And so maybe it's a matter of somebody just kind of filling in, taking over with the sterilization, or filling in with the patient to take radiographs or something, and give that person a time to kind of go to a safe place to recover from their little grief attack, and have some tissue, some lotion, some Visine, because they come back with those bright red eyes. People are going to know. So provide them a place. Let them know that you're going to expect that's going to happen every once in a while. And be prepared. Be prepared for the next calamity or catastrophe that might hit your office. I really want to ask all of you to develop an emotional emergency plan that you include in your office manual. What do you do when patients are suffering? What do you do when someone's lost a husband or a child, or a job, or a divorce? What do you do? What do you do to support them? And if you can have a plan that supports your patients and supports your team, you're going to have better treatment, happier patient, happier dentist, happier dental team, just in general. There are so many benefits to preparing for emotional emergencies in your dental office before they occur. So, don't let fear and anxiety triumph. The COVID-19 virus has already disrupted enough of your life. Don't let it defeat you personally. Work hard to overcome the battle in your brain by consciously fighting the fear. Strive for contentment. Eventually, the peace and the happiness and even joy will follow. And I can tell you from first experience, I experience all of those things now. You can recover from this. We can't control the things that happen to us, but by working to keep our brains in a healthy, positive zone during this pandemic, we can be assured that when this is all over, we'll still be standing strong. So let's get ready to manage this one and the next, and develop your own emotional emergency handbook. If you would like a copy of the small emotional emergency handbook, the mini book, just go to dentalmediator.com and contact me through the contact portal, and you can ask for the PDF of the handbook, and I'll be happy to send this to you. Life is going to get better. Do your best not to worry. You've got this. Thank you very much.